sometimes those kidneys are put on ice. And sometimes those kidneys kind of need a little jump start. I kind of look at it as like jumper cables, kind of like a car battery. It kind of gets a little low. Sometimes you got to jump it. Sometimes the kidney needs a little jump start, and that is dialysis that would do that jump starting. We know that the graft survival rate is that much longer. We know that a deceased donor kidney typically lasts about 14.5 years. Living kidney donor lasts about 26.6 years. So there is some significant benefits to a living donor versus a deceased donor. When we're talking about younger individuals, let's say a 20-year-old who is in need of a kidney transplant, of course we're going to want to give them something that is going to give them a long life expectancy, because they more than likely may require another transplant down the road. So we want to give them as much time that they possibly can have with that kidney, and their best option is living donation. The numbers that I did just give you, deceased donor kidneys last about 14.7, I was 14.5, and living kidney donor transplants about 26.6. Some considerations for living donors. Obviously, we need to have 2 kidneys in order to donate 1. Blood group compatibility. We also do incompatible incompatible transplants, okay? You don't necessarily have to have blood type compatibility, okay? The age of a donor needs to be anywhere between the age of 18 and 60-ish. Sometimes it's a little bit older, but 60-ish, if you're in your 60s and you're really healthy, that's pretty spectacular. We don't see too many people that old that are really, really, truly that healthy that could be a kidney donor. A kidney donor can be related to a recipient or unrelated to a recipient. They don't necessarily have to have a relationship. They need to be in excellent health, and part of my job as a living donor coordinator is to prove that health. Yes?
I'm sorry if I missed it. Did you want questions along the way, questions at the end?
Sure, we can do questions along the way.
I guess I was wondering if you solicited living donors between the age of 18 and 60-ish, do they use that same guideline when they are obtaining people that are organs for people that are waiting on the list?
So the question is that if, are you talking about a deceased donor?
Yes, if you are advising us, this is the age range that would be good to solicit.
For a living donor.
Living donor.
Mm-hmm.
Do the people who are procuring these kidneys from the deceased donors consider those same things when you get to the 60s?
No.
Around here?
No. No. The question is, we are online, so I'm going to repeat the question. The question is do we look at when we procure organs, so a deceased organ, are we keeping it in that same age group? And no, that is not it. We can have any age. It can be any age at that point. The family just needs to agree to be a donor. So it can be, a donor can be less than 18 and it can be over 60. Does that answer your question? Okay. Our donors also need to be, we need to make sure that they have financial preparedness. So what that means is that we want to make sure that when they donate their kidney, with their taking time off of work for their recovery, recouping, if they have to travel to our center for tests, that we're not putting them in any financial, we're not financially burdening them. So we want to make sure that they're in a good system, that they have a good support system financially as well. Yes?
What is the recuperation?
The recuperation time for a living kidney donor is, there is a 6-week lifting restriction of 10 pounds or heavier. We do highly recommend our donors to at least take a minimum of 2 to 3 weeks off of work. If they can afford to take a full 6 weeks off of work, we strongly advise for that. We also want to make sure that our donors have a good support system because they've had major abdominal surgery, and when they go home, they're going to need some assistance when they go home. Okay, they're not going to be able to lift greater than 10 pounds. So 10 pounds is a gallon of milk. So if you really think about it, how much do you lift in a day that is greater than 10 pounds? A lot, okay? Also just simple things, like if your laundry is not on the first floor, you're not going to be able to go, you're not going to want to go up and down the stairs. You're not going to be able to lift a laundry basket. So those are things that you're going to need some assistance with at home. We also ask that our donors just be committed to the process. It's a long, lengthy process sometimes, and it can be, we can ask a lot of questions and we can ask for additional testing. So we just ask for some commitment to that process. So when we talk about options for living kidney donation, we always have the option of somebody coming forward and being a good Samaritan. Somebody who just feels the need, feels like they have to give back, and wants to donate to whomever. They don't have an intended person, they just want to donate. Okay? We also can do direct donation, which is would be me directly donating to my recipient. They can be related or they can be unrelated. We also do blood group incompatible transplants. We do positive cross-match transplants. So when we talk about positive cross-match, a lot of people think positive is a good thing. In this case, positive is not a good thing, okay? Positive means bad. Positive means that the recipient has a highly likelihood of rejecting the kidney that they're receiving, okay? We also can do paired exchange programs. We do participate at Freightert. We participate in 3 paired exchange programs. We participate in UNOS, NKR, and Alliance. So the best way for me to describe a paired exchange program is a mother wanted to donate to her son, but they were not compatible. They weren't compatible either blood group or they weren't compatible tissue type. They're just not compatible. A husband wanted to donate to his wife in the same situation. They weren't compatible, okay? But in a swap or an exchange, the husband from the second group was able to donate to the son, and the mother was able to donate to the wife. Okay, so that's simple, pretty self-explanatory. Then we can kind of get a little crazy, and we can be involved in a chain. It could start with a Good Samaritan. Ooh, what happened? It could start with a Good Samaritan, or it could just start with a donor, and it kind of just trickles. The caveat with this is that these kidneys are being sent from center to center, okay? So a kidney could be coming to our center from New York, and we could be sending a kidney to California, okay? So those kidneys are being put on ice, and they are being sent on an airplane to the respected center, and vice versa. Does anybody have any questions about that?
Is that arranged? Or
It is arranged, and it is all scheduled, and it is all planned. So these are all planned. We know when this is going to happen. We have a date. We have a surgery time. We have all of this scheduled. Living donation is scheduled. Deceased donor, we never know when that's going to happen. Okay? Any other questions? Yes?
So it's not a given a family member will be a match.
It's not a given that a family member will be a match, correct?
If they give you their bone marrow, would it be likely she'd be a match?
It's very likely. If the question is if somebody gave you their bone marrow, would they be a match? And the likelihood is very high that they would be a match, yes. Okay. So the evaluation process. So in our center, the first step that we do is a questionnaire. It's a two-page questionnaire. It's a lot of questions, health questions, previous health history. Do you know your blood type? Do you not know your blood type? Then in our center, our nurses, we do a phone interview. It can be anywhere from half an hour to an hour-long phone interview where we review all of the health history with the donor over the phone, just to gather some more information. We then send that information off to our transplant nephrologist, who then determines what our next steps may be. If our transplant nephrologist comes back and says, you know what, this person looks really good, let's bring them in for an evaluation, we will bring them in for a full evaluation. In our center, we try to do a full day evaluation, which consists of coming in, starting at about 6 a.m. in the morning with fasting labs, and then it ends at the end of the day with a CT scan. In between there, you will meet with a multidisciplinary team, which consists of a transplant nephrologist, surgeon if they're not in the OR, a pharmacist, a dietitian, a social worker, and then we have an independent living donor advocate that we have our patients meet with. Okay? Once we've obtained all of those test results and it doesn't appear that there's any additional testing that needs to be done, we present our donors to a committee. In that committee, it's determined if whether or not they are a suitable candidate for donation. So a lot of people ask, well, who sits on this committee? Who is making these decisions? The committee consists of the medical director, the surgical director, the surgeons, the transplant surgeons, additional transplant nephrologists. All of the team that you met with that day sits in on that committee. Sometimes nephrologists will sit in, and it's a committee to come together to determine, yes, medically this person is acceptable or not acceptable. It's not just me saying, yes, they are, or the surgeon saying yes. It's a committee that comes together to decide together that it is acceptable or unacceptable. Once we've determined if a donor is acceptable and has been approved to be a donor, then we do their tissue typing. Okay, so then we determine whether or not they are the direct donor or an indirect donor. Yes?
Just out of curiosity, when you fill out the questionnaire at the start of this, what necessarily knocks you out of running in that questionnaire?
There's not too much that, the question was with the questionnaire, when you're filling it out, what would knock you out in the beginning? There's not too much that would knock you out. Most of the time, us nurses are calling and investigating and just getting more information. A lot of times patients don't really know what we're asking with those questions because it's very black and white. Did you ever have high blood pressure? Did you ever have depression? Did you ever have anxiety? So we want to investigate more. If somebody put on their form that, that they just recently had a heart attack, that would definitely eliminate them. Okay, so it would have to be something very major. If they're recently had breast cancer and they just went through chemo and radiation therapy, they're not a candidate. Okay?
What's the timing of going through that? I know you just spoke through it as though it was
Really quick?
but is it?
It can go really quick, sure. It can go as quick as about a 2-week period to as long as 3, 6, 9, a year. It just depends upon sometimes how fast the donor wants to move, and it depends upon how much additional information we need to obtain, how much additional testing we have to do. Not every donor, not every recipient are identical. So every case is individual. Yes, Cindy.
If someone wants to donate to someone in another state, they can start some things here, or
Yeah.
how do you work with other transplant centers?
So the question is how do we work with other transplant centers? So we at our center do allow our patients or the donors to do some workup in another state. However, we do prefer as much that we can do at our center. At the end of the day, the donor is going to have to come to our center to meet with our team. So if there's blood tests that we can do, we'll do blood tests at other centers. But scans, like CT scans, that stuff we prefer to have done at our center because our radiologists have it. We have all of it at our fingertips. But that doesn't necessarily mean that we will not work with other transplant centers for our patients or donors to be worked up, if that makes sense. It just depends. It's always an individual situation. and we do our best to work with the donors. Obviously, they're coming forward and doing something very noble, and we want to make sure that we're accommodating to them as well. Any other questions? Yes.
Well, just to follow up on that question, so the person to ask at a transplant center is the living donor coordinator if you have questions about that?
Yeah, yes. So the person to ask in regards to workup at another center is the living donor coordinator, because I would have to work with the other center to make sure that they would agree to doing the testing. So I would have to find a center, a transplant center near that donor where they live or wherever they may be, and kind of get an agreement with them that they would be willing to work up a patient for us. And vice versa. We've worked up other donors for other centers as well. Yes?
Is there some type of science that says a person that donates will eventually need dialysis at some point because they have donated?
No. No. All right, let's talk about the surgery a little bit. So the surgery is typically done laparoscopically. Not to say that it can never be done open. Preferred method is laparoscopic. The kidney is removed through a small incision through the stomach. There typically is anywhere between 2 to 3 small incisions on the side that the kidney is being removed. The purpose for those small incisions is for the instrumentation for the laparoscope. So for the camera, for the instruments to kind of cut and snip. And then the midline incision is for the doctor to go in, get the kidney, and bring it out. Okay? Typically, the donor surgery is anywhere from 2 to 3 hours. Hospital stay is typically 3 days, but can be up to 5 days. In our center, lately, our typical hospital stay has been right at 3 days. So we find our donors are so healthy going in, they feel good, they want to get home, and we know that the sooner we get people out of the hospital, the better that they do, the less likely that they're going to acquire any hospital infections, and they just generally feel better being at home. Again, there is that lifting restriction of 10 pounds or heavier for 6 weeks, and the expected recovery is anywhere from 4 to 6 weeks. So there's a lot of controversy in regards to time off of work, always. A lot of people always want to rush to get back to work after they've had a major surgery. And my theory behind this, so this is just my theory, is in life, we don't have too many opportunities where we get to take some time off of work. Am I right? Okay. If you're given the opportunity to take 6 weeks off to recover and feel really good, I highly encourage you to do it. Okay? We sometimes set ourselves up for failure. Okay? We set ourselves up like, okay, I'm going to go back to work in 4 weeks. And what if in 4 weeks you're just not feeling right? And then you go back to work and then you realize, this really, I shouldn't have done it. So my best advice to donors always is to take the 6 weeks. If you feel like you can go back sooner, but don't set yourself up to be disappointed that you didn't make that goal, like at 4 weeks you weren't feeling great. You only have so many opportunities to take that time off, and it's acceptable. Take the time, recover. You went through major surgery. It's important to give your body time to rest. So that's my advice. All right. Any questions about that? How much time did you take off?
So I took off the full 6 weeks, and I felt back to normal at 4 weeks, but I was so glad I took that extra 2 weeks just to have that time to fully recover. And I did go back to work in yoga pants just because that's my body type, and that's what I needed to do.
Yeah. So for myself, and I stayed off of work actually for 8 weeks. And part of that is because of my line of work. And there was a lot of controversy what if a patient were to fall what if I were to be put in a situation where I would have to assist somebody, and would I be putting myself in, surgical harm? So I took the additional time. I felt good at 6 weeks, could have went back at 6 weeks, but they just extended it by an additional 2 weeks. Any other questions, comments? Okay. So when we take a kidney, we have got to, obviously, we have to take it out. We have to cut the renal vein. We also have to cut the artery and clamp it. And we also have to clamp and cut the ureter. So this is kind of just an example of what we all have to clamp and cut in order to get the kidney out. Post-op. So again, I'd like to reiterate the lifting restriction because a lot of people try to overdo it. No driving for up to 6 weeks. That really is extreme. It's typically about 2 weeks. Most donors are taking some form of a pain medication, a narcotic, usually a week to 2 weeks after donating their kidney. So we definitely do not want them driving. We also feel that 2 weeks is a good time frame of not driving because you're not sure what your reflexes are at that point. So it's really a good idea not to drive for 2 weeks. And then the first time that you do drive a car, we really want you to have a passenger. So in the event that you feel like you can't drive, that they can take over the wheel for you. We also encourage a short trip, like if it's just running to the grocery store or whatnot. Not that you plan like, whoa, I'm going to go to Indiana for the weekend and there you are in the car for 5 hours. Not a good idea. Okay. We typically see our patients after they've had their surgery about 7 to 14 days for their first visit. In that visit, we do check labs just to see how things are going. We do check a urinalysis and go from there. Then we also follow our patients in 6 months and then annually for 2 years.
Is that with this team or is that with your own personal care physician?
The question is that with our team or with personal care physicians? So the first up to the 6 months is with us. At your 1 year anniversary, we ask that you follow up with your primary care doctor, have lab tests done with them. We will send them a letter asking them to do certain labs and urine and all that good stuff. We would like to see those results because then we report them to UNOS as well. And then every year thereafter, you should make it consistent that you follow up with your primary care and you continue to have, your kidney function tested and just make sure that you're moving along just fine. If there's any complications or if there's any issues related to you donating your kidney, obviously the transplant center will see you at any time. Okay? In regards to live donor coverage, so all of the testing, the surgery, the hospitalization, the post-op visits, any complications are billed to the recipient's insurance through our center, okay? A donor's insurance should never be billed. And if the donor's insurance has been billed, we want those bills and we want to rectify it. They should never be billed. Occasionally, it slips through the cracks. Somehow the billing gets, I don't even know how it gets through, like all of the testing was covered and then all of a sudden a bill arrives at the donor's home. Should not happen. Occasionally we have to do some testing at a local facility. So if you live in Green Bay and we did all the testing here and we just want to get another urine specimen on you, we can do that at your Green Bay facility. We usually send the hospital a billing form that they should specifically bill us. But sometimes it just doesn't work. Even if you give them all the information, it just doesn't happen. So any donor that receives a bill in relation to the workup, anything, they should send that bill to the respected transplant center. Some private health insurance policies may pay for traveling lodging for the donor. A lot of times the financial liaison with the transplant center will let the recipient know that because they've investigated that part of their policy very thoroughly. That is not part of a transplant coordinator's role. We have specific financial liaisons that's what they do, that's what they focus on, is all transplant, insurance, benefits, all of that they handle for our recipients for the program. Yes?
I thought I remembered that there was a person or a group that would work with families if they were trying to raise funds for the donor to cover time off if it is not paid. Do you have?
Yep, there is some, our social workers are really good with working with patients to help set up fundraising. There is, I think I have it on here too, assistance for donors. There's tax deductions. There's the National Living Donor Assistance Program. There's all kinds of opportunities and options for donors.
And that's through the social worker that met with the person who needed the kidney?
Yep, yep. And the social worker who met with the donor is also able to help facilitate that as well.
So that's a different thing. So the social worker for the
Recipient is different than the donor. Yep. So we highly recommend that our donors have their own personal insurance, health insurance, in the event that, not related to their kidney, but if something happens, that they have insurance coverage to cover any medical issues down the road. We also highly encourage life insurance, disability insurance. When it comes to life insurance, a lot of people ask about that. We, in our program, we recommend patients, if they have a life insurance policy, great, okay? If you're thinking of doing anything with your life insurance policy, like changing your coverage, increasing your coverage, for a donor, we recommend that you look into it. And if you want to make changes, we ask that you look into making them before you donate. Some life insurance policies and companies require proof of health. So they may require you a time period where you have to prove your health. They may bump up your premiums. You know, it's hard to say what your company may or may not do. They may not do anything. But in the event that you're thinking of making changes, just maybe look into it before donating. Currently in the state of Wisconsin, there is no pre-existing condition clause, so we don't have to worry about that under our Health Care Act right now, but as time changes and as government changes, those things may change. So always just make sure that you are staying on top of it. If you are a donor and you have insurance coverage, always make sure that you have insurance coverage. Don't make it lapse. You don't want to ever have a time where you are not covered by insurance. Okay. I think we kind of went over the resources. Transplant social workers, financial liaisons. We have counselors. Some of the assistance for donors. Again, I kind of mentioned this before. There is state of Wisconsin does offer a one-time tax deduction up to $10,000. They ask that you kind of, we ask that you kind of lump sum everything, and then you can do a one-time tax deduction up to $10,000. Some employers allow paid time off. State of Wisconsin employees, I believe, get 4 weeks paid, no questions asked for being a donor. You may tap into your short-term disability if you have short-term disability. Again, there's that National Living Donor Assistance. It's a fund for donors in regards to lodging and travel. And then there's always the opportunity to do some fundraising. Again, just kind of reiterating, donors should obtain and maintain their own health insurance. They should obtain and maintain short-term and long-term disability. And they should consider obtaining life and disability insurance prior to donation. Any questions about that? So how does living donation affect the donor? Well, you can live a normal life with one kidney. There's a lot of people walking around that have only one kidney and don't even know it. Okay? The kidney that has been left will increase in size. It's not a significant increase, but it will increase in size to maintain your needs. We do just encourage physical exercise and a healthy lifestyle. Does living donation affect life expectancy? Does not change your life expectancy. Does not appear to increase the risk of kidney failure. With our testing process, it is so thorough that if there's a likelihood that you could develop any kidney problems down the road, we are not going to pursue you as a donor. Okay? What it may do is increase the risk of developing high blood pressure. So we strongly encourage all of our donors to make sure that you're checking your blood pressure, you're maintaining with your physician, you're following a low sodium or a low salt diet, you're just maintaining a healthy lifestyle. All of those things will keep your risk factors of developing high blood pressure that much lower. What can I expect emotionally after donating a kidney? Well, there's a wide range of emotions, and I always describe end-stage renal disease in general like being on a roller coaster, okay? For those people who are in the need of a kidney, okay, they're going to Great America and they've hopped on the biggest roller coaster that there is there, okay? They're on that roller coaster and they are continually to go up and down, and they're continuing to go fast. They're having bumpy roads, okay? They're hitting some bumps. Sometimes they have to take a fast turn. Sometimes they have to slow it down, okay? This is their journey. This is the ride that they're on, and they will never leave that ride, okay? Even after transplant, there may be some bumps in the road for them, but they're on this ride and they're continuing to move forward, okay? As a donor, you kind of are on a little bit of that ride too. You're going to feel really great and feel really joyful, and then sometimes you may be like, what did I just do, right? Because that's a normal feeling. So there is a wide range of emotions that go in with donating a kidney. What I can say is the best thing for our donors is to talk about what you're feeling. We offer all of our donors the opportunity to speak with a transplant psychologist. We offer them the opportunity to speak with our independent donor advocate at any time, our social workers, us as coordinators. Any time that they are feeling any of these emotions, we encourage them to reach out. Most donors rate their experience as a positive experience. So we only want to focus on the positives. There's always going to be somebody that's going to have a negative experience, but we want to focus on the positive. What are the long-term risks of a donation? Well, darn it, there's a scar involved. But nowadays, we use glue. The scars are closed up with glue, and it heals beautiful. Back in 1999, when I donated my kidney, I had staples, and I have like a railroad track as a scar. So, you know, we've really come along as time has gone on. Some donors report problems with some nerve pain. So when they make an incision, they have to cut through some of the nerves. So sometimes when those nerves actually start growing back and coming back together, some people kind of get like a funny, like a numb sensation. That's everything kind of coming back together, and it's an unusual sensation for some patients. Some people never experience it. Some people, after donating their kidney, may develop a hernia. That's just because we've opened up the abdominal wall. We've lessened the elasticity, and so the likelihood is there. Some people can develop an intestinal obstruction. People with one kidney may be at a greater risk for high blood pressure. They may be at a higher risk for a little bit of protein in their urine. And they may, and we know, will have reduced kidney function. Okay? We know after donating a kidney, your kidney function is going to decrease by 25 to 35%. So we know that that's normal.
Permanently?
Permanently. So what happens if I donate my kidney and something happens with the kidney that I have? And I need a transplant myself. Well, UNOS gives donors priority on the waiting list. It doesn't move them all the way up to the top, but it gives them a great priority to move up significantly, okay? So it moves them up on the cadaver list, so the deceased donor list. So obviously if I'm a donor myself and I need a kidney transplant, I'm probably going to want to pursue a living donor for myself, right? So, and that doesn't really help this situation, but it does kind of give a payback or a thank you back.
I have one question.
Yeah.
So for, I don't know how you classified it, but those people who just want to donate without any relationship, just want to help somebody?
Good Samaritan.
Good
Mhm.
Samaritan, yes. Those types of people would never interact with the waitlist folks. Those would always go into the swapping category, is that correct?
No, a Good Samaritan would go into the waitlist folks. Any other questions?
What does UNO stand for?
United Network for
Organ Sharing. There you go. United Network for Organ Sharing. I always tongue twisted. Any other questions? So a lot of questions that we get from women are, can I become pregnant after I've donated my kidney? Well, the answer to that is yes. Our recommendation in our center is that you wait at least 6 months after donating your kidney to become pregnant. I highly encourage at least a year. Your body's going through a lot of changes after you've donated your kidney. You've had anesthesia. Giving your body a good year to kind of just regulate and adjust. There is a small risk for developing gestational diabetes and pregnancy-induced hypertension, and there is a slight increase in developing protein in the urine and preeclampsia. So I donated my kidney, like I said, in 1999. I had my first child in 2007, and I had another one in 2011 with no complications whatsoever. And I've had no complications since then. So I had 2 very normal pregnancies. I never had to follow a high-risk OB. I went to my regular OB who just monitored me, and in the event that something were to awry, I would then be transitioned to a high-risk OB. So those are a lot of the questions that we do get from a lot of women is, you know, well, will I be a high risk? Well, most OBs in the community say there's no indication for you to be a high risk until there's an indication, actually. If we are seeing an elevated in your blood pressure, if we're seeing a lot of protein in your urine, then we're going to have you follow with a specialist. But most OBs have no concerns or any issues with that. Any questions about that? That's all I have for you guys.
Are these slides available?
We can post them on our website.
We can post these slides on the National Kidney Foundation website. Sure.
And you can tell us which one, I'm sure there are other slides in there, but you'll tell us, you can share with us how to get to this individual. Okay.
Yeah, it's just kidneywi.org. We'll have it posted on Monday. I'm wondering, were there any questions online, or maybe Michelle might talk a little bit more?
Michelle is a donor. I think we're disconnected online. How are you? So you can introduce yourself. Michelle is a donor as well.
Hello everyone, I'm Michelle Sherman. I am a living kidney donor, and my donation anniversary is August of 2014. So I'm a little bit past 2 years post-transplant, and I always love coming to this presentation because it reminds me of the remarkable experience of giving the gift of life. And I donated my kidney to the father of one of my best friends from high school. So I'm a non-relative match. At the time, and I can't, I will see if anyone in this room is, has beat me in my scores, but at the time of donation, I was a 50% match to Dick. And that at the time was the highest non-relative match that Fredert has seen in their transplant history. So again, as every...
No, you're higher than me. Yeah, you beat me.
No, as Stacy said, this is such an individual journey for so many people, and every patient, every donor, every recipient is so different. And for me, what that meant is that not only was Mr. Hanusa getting a living organ, which is going to last a lot longer, he's in his 60s, but he was also going to have a less likelihood of rejecting me, which we've talked a lot about in terms of him being able to live that happy, healthy lifestyle that he's now enjoying so much, being that there was such a good match percentage there. So, and he's doing great. I'm feeling really good. Everything in this presentation pretty much was on par. The team here does such a fabulous job of educating and inviting questions and really helping you think through the whole stages of donation, pre, during, and then long term. What lifestyle may be like for you, what questions you may have, just that whole journey. So I came into this process feeling very naive. My friend and I were traveling to a Bon Jovi concert in Chicago, and I said, well, I don't know anything about kidney donation, but let me go learn. And I was so fortunate to have the team here and the wonderful staff to be able to help, again, educate me and really share with me the risks, because there are minimal risks. And, you know, I remember waking up from surgery being like, I'm alive. Like, I can do anything at this point. Made it through, you know, that piece. And, but again, not many issues, complications, pretty much standard to what they talk about post-surgery, what you should expect, how you should feel. But if you take good care of yourself, and again, everyone's in excellent health if they're at this point of considering donation, you just take good care of yourself, follow those steps, drink lots of water. I'm so glad every time I come here, Cindy has water for us. If I think anything long term, now that I'm 2 years out, I feel the dehydration. I'm a full-time working mother, and I've probably been dehydrated every day of my life. But with 2 kidneys, didn't know it. With 1, I'm like, whew. I can tell when I'm not getting enough water intake. So again, something they tell you, but something to really think about, always having that water jug with you. And then the joys of no longer having an NSAID. So
I didn't even mention that in my program, but non-steroidal anti-inflammatory drugs, so the NSAIDs, so Advil, Aleve, Motrin, ibuprofen, naproxen, naproxen, those medications are in the class NSAIDs. Those drugs are metabolized and excreted in the kidneys, so they're very, very toxic to the kidneys. So those of you that are in end-stage renal disease should never take them, and donors should never take them, okay? And we really focus a lot of that in our practice, that even like when we're talking to patients on the phone and going through the workup, that they should eliminate it now. Just get it out of your system. Don't think about taking it. It will never be allowed in your home again. You will never take it again, okay? For those of you who may be in the room who are in that end-stage renal, who have impaired kidney function, should never take an NSAID ever again, okay?
well, thank you for teaching me how to say it properly. NSAID. There you go.
There you go.
There you go. So, but other than that, life is good.
Any other questions? Yes?
What are the statistics on rejection?
So that's a really blanket question. There's a lot of factors that go in with rejection. So to give you this straight black and white, I wouldn't even want to entertain that, because there are a lot of statistics and there's a lot of factors. It can be drug-induced. It can be, you name it. So there's too many factors that go in it.
Did you mean statistics about getting a living donor kidney as opposed to deceased, or just once you get one as a
In general,
recipient?
like if, a sister would be my likely donor, I mean, the rejection rate, I would think would be low.
That's a perception. That's not necessarily the truth of the matter. So even though they're a blood relative, it doesn't necessarily mean that they're the best match for you or the best donor for you, okay? A perfect stranger could actually be a better match for you than a sibling, if that makes sense. So when we talk about matching a kidney, we don't just focus on the blood typing. There's tissue typing involved too. There's antibodies and antigens. So we have to be very specific. Most women have antibodies. Most women who have had children have antibodies because every pregnancy you build up more antibodies. So it makes things a little bit challenging when we are trying to match up, especially females. It's not always the case, but it can be that. Anybody who's received a blood transfusion has received some form of an antibody from another individual. So all of those factors play into it. So not necessarily is a sibling going to be the best match. The best match on a sibling side would be an identical twin. That's basically, family-wise, would be the best.
And even though I have her bone marrow now and her blood type and that all changed?
So that's a little bit different. That's not a normal scenario. So, but that's not always the case either. There are some additional testing that would have to be done. Because it's not just blood type, it's also the tissue type. And that's where we have to get that mindset that it's not just blood typing, there's tissue involved. There's antibodies involved as well.
Thank you.
Yep. Yeah.
So for you guys,
Yep.
what type of scenario was it for you to hear of the need? It's your experience, maybe somebody else's experience, but like what was your experience? Was it an online reading? Was it a family meeting?
Sure.
Church service? I don't know.
So I don't know if you heard my story.
Just step a little closer.
Oh, are we still on? Okay. So for my story, I donated to my now husband. So I knew the need when he went into the hospital and was in acute renal failure and had to start dialysis. And, he was actually 23 years old when this had happened. And at that time, the doctor said to us, transplant is his only option. Like, there's no, he cannot live the rest of his life on dialysis. He needs a transplant. So at that point, that was our focus, is a transplant. So obviously I was not the first person, and I was not the most, how do I want to say it, the most attractive donor for them, because back in 1999, a non-related person was unheard of to donate a kidney. The thought process in the 1990s was they had to be related to be a living donor. Absolutely, had to be related. So in my situation, my husband has a very big extended family, but has a very small direct family. His parents were not able to donate to him because they've had kidney stones. They've had issues themselves, high blood pressure, you name it. He has one sibling who was not a match to him. Had a lot of extended family, an aunt who was a match to him, but in the testing process we found that she had high blood pressure and was deemed not a candidate for donation. Part of that, down the road now that she's gotten older, she's developed diabetes. So it was kind of a blessing that she wasn't his donor, because it could have been it could have been a bad outcome for her. So he has a lot of cousins. A lot of his cousins came forward, but none of them were blood type matches. And back in the 1990s, there wasn't paired exchange programs either. So I had an epiphany, and I thought, it's me. It's got to be me. We have the same blood types, and we knew that. Like, we have the same family makeup. We're good to go. So I begged and I pleaded, and I'm not telling you this lightly. I begged and I pleaded the transplant team to test me. And they were very hesitant at first because the likelihood of me being his donor was very, very slim to none. So finally, I convinced them. I came in, did all of my workup, passed all of the tests with flying colors. Then it came to the blood testing to make sure that we were compatible. And lo and behold, we were compatible. So that's how we went on. So in my journey, I knew that that was what, that I was going to do that. But from that has made me go into this field. I was not a registered nurse when I went through this process. I was in the medical field. I was a medical assistant. That only pushed me to go on to school and become a registered nurse. And with that, I've worked my way into transplant. I started off, well, I've done a lot of different things, but my transplant journey started when I worked in home care. I worked home care with transplant patients, so if they had to come home and they had to do some IV therapies, if they needed IV hydration, I would do that in their home. I then moved on to being a dialysis nurse, so I got that aspect, and then I moved into transplant. So because of my experience with kidney donation and my experience with my husband being a kidney recipient has only pushed me into my journey and into my career and has made it that much more powerful for me. I can speak to donors as a donor. I know what they're going to go through after they've had their surgery. I know what the recipients are going to go through after they've received a kidney, the adjustments that they have to their medications and, you know, the ups and downs. If they're on dialysis, they're fluid restricted. Well, when they have a transplant, we're telling them to push fluids. You have to do a lot of reverse psychology with patients. And I've experienced all of that. So I know, and I know the emotional aspect that goes in with it. I know that roller coaster ride. I've been on it. I've jumped off of it. I've gone back on it, and I continue to ride it. It's a journey.
We have a question from online. The question is, how do you let people know you need a kidney? How would I ask someone to consider to be my donor?
So the question is how would I let someone know I need a kidney and how to be a donor? So that's a really good question, and there's not a right answer to it. What I highly encourage is for the recipients to get to know their story. How did they get in the situation that they got into? Was it a traumatic accident? Was it, you know, I wasn't taking care of myself for years and my blood pressure was out of control and I didn't know it, and, you know, here I am and now I'm in end-stage renal disease. Get to know how you got to that point. And be real and be true to yourself and be true to those that you want to tell. I highly encourage patients to reach out to their social networks. Who are your groups? Do you belong to a church group? Do you belong to a knitting group? Are you in 4-H with your kids? Do you go to the YMCA? Any people that you're connected to, the more you talk about your need for a kidney transplant, the better off you are. The more that you're interested in sharing your story, the better off you are. We do know that 1 out of every 4 people are willing to donate their kidney. They just need to know the who and the why. Well, they're not going to know the who and the why if you as a recipient aren't talking about it. I can't do that for you. You have to do that too. I can work up all the donors that you bring to me, but I can't go out and get those donors. They have to come to me free will. Okay? We actually have a person in the audience who has done a phenomenal job of getting out there and getting her message across. And Michelle, do you mind coming up and kind of sharing? Okay. So Michelle is in need of a kidney, and she has done a phenomenal job of promoting her need for a kidney. And I'm going to ask her to kind of share some of the things that she's done because she has done a phenomenal job.
Michelle. I was born with a birth defect. I had 3 kidneys and 2 bladders when I was born. 2 of the kidneys did not function. They actually, for 3 months, they didn't know what was going on with me. And 1 bladder was inside the other bladder. So they went in. I had 3 surgeries when I was a baby to take care of that. And I only have 1 kidney and 1 bladder. And had multiple infections throughout life and stent placements, and now so I'm here at this point looking for a kidney transplant. And once I found out, I kind of took a nosedive over last winter and went to the appointment and said that we need to start getting you on the list, and went to the meeting at Freighter, and it took a while for me to, excuse me, so it took a while for me to get the courage to ask someone. It's a huge ask, and it took me actually a couple months after I got onto the transplant list to get my thoughts together and how I wanted to explain my story. I wanted to start from the beginning, and so I started with a family letter that went out to everyone by mail. My dad had that family letter in an email. He sent it to everyone on his directory, whether they were family, friend, or just a work acquaintance. And that stem cell to someone that he knew from a church congregation, and they sent it to the entire church congregation. When I went to my work, and a lot of this is my work too, my family did a lot. My husband's side of the family did a lot. I went to work and I told my friends there, and they started a campaign advertising for me. So they started a team, and we put together postcards to hand out at different functions. We did another letter through my organization in their newspaper. We did a Facebook page. We did t-shirts. We went to a farmer's market. We had someone that was in crafts. They made a kidney costume to go to this farmer's market. After the story got out, more people would come to me about their stories, and I even had a gentleman come to my work and say, I just had a transplant a couple months ago. Here are all the leftover marketing materials. The green donor bracelets, the donor pins, and he gave me all kinds of information that I could share with at the farmer's market. And I think it was just realizing how many people are in this spot is really hard and hard to grasp. It's not just me, it's thousands of other people, and it's not just organs, it's blood donation as well. I mean, it's all tied into one. So anything you can think of, there's people that put advertising on their cars or a sign in their front yard. It is hard to talk about. It's kind of a humbling experience, and there are people, so many kind people out there that are willing to donate and help someone so that they can have a longer life. No one expects you to be in this position. It's serious. If you don't have a kidney, you won't survive, and dialysis is not a great alternative, and I'm very thankful that I'm not on dialysis yet. That was the start of 2017, and I'm thankful that I have a donor. She's here today, and we've got a date for December 14th, so it's a blessing, and I get so whatever you can do, just say it. I know it's hard. I mean, we sat at a farmer's market, and people, it's not easy. Some people are turned away from, this type of medical deal. But even if you're just talking about blood donation, that helps.
Or did you sign your driver's license, or do you have the sticker on your driver's license? Did you sign on the registry? Just even that. And then bringing up, you know, we have the kidney costume there, and people that were interested would come to you. So that was it. So thank you. Sorry. Thank you.
Nope. Okay.
Well, this is Cindy again. I just wanted to say thank you to both of the Michelles, and I'm sure maybe here in the room we'll stick around a bit. Just a footnote to your thought, though, Michelle, is the holidays are coming up, and I think taking, you know, what you just said and kind of thinking about in the next few weeks, this is a great opportunity. Because you can't sit and watch football the whole time, you know, or you wind up talking to people that aren't that exciting. So talk about something that means something to you. I mean, we've got a great opportunity with this season. I'm also proud to say that in March of this next year, we'll be actually doing a whole session. We'll be working with Allison, one of the social workers here at Freighter, and we'll be doing an entire session on just different ways that people that are looking for a donor can create those conversations. So we'll kind of keep you posted on that you can share with other people that you may encounter along your different journeys that are also looking. But I just want to thank Stacy again. We kind of get 2 for 1 when Stacy talks, and with Michelle, who's a living donor and an active volunteer with our organization, because we rely completely on volunteers. Merle and John are here in the room, and they're both recipients, and they volunteer regularly for our organization, and this is one of the ways that they give back to help get information out to patients and families and interested folks throughout the state. So thank you all for coming tonight. Those of you in the room, if you can leave your evaluations, and those of you that were online, you know, please email your comments to us, because we hope to expand and improve our efforts to provide online access to join us here in the room. Thank you very much.
Yes, Nicole.
I have another question, actually. So the recipient, when they receive the living donor or the living organ, the estimated time, what, 26, 27 years, what happens after that when the kidney stops functioning? Are they allowed to go back on another living donor list?
Yep.